We are joined now by financial expert Jenny Groberg. Jenny is the CEO and founder of BookSmarts Accounting and Bookkeeping. Jenny, today we're talking about medical bills and specifically how millennials are struggling with medical debt and how to start tackling some of those bills. So first of all, you just defined millennials for me. What's the age?
Millennials, you're looking 27 to 44.
Okay, because I'm 45. I identify as a millennial.
Yes.
I'm going to lump myself in with
I
that
think you
category.
count, Lincoln.
Okay,
you count.
Cool. What, is this a big issue for millennials?
This is because, up until the age of 26, a lot of teenagers, young adults can be carried under their parents' insurance. 60 plus, you're on Medicare. So this is really a problematic age group because a lot of people are underinsured. They have insurance gaps. They lack coverage or don't have coverage at all. And if they have an issue come up, they don't have the money for it.
How many millennials are we talking about?
I think it said 32% have medical debt.
Of some kind, then.
Yeah,
that's a
of
really
some
big
kind.
number.
It's big. But I did dive deep into this, and on the whole, it's less than $1,000.
Okay, so for most of those people.
For most people, it's under $1,000. But I think that goes to show, too, that no one has a savings account, right? 80% of the country lives paycheck to paycheck. And so when you have a medical expense come up, that is unplanned for. That's not something that you're anticipating. So a lot of people have a hard time covering that.
Yeah, for a lot of people, even $1,000 is
a big deal.
Kind of insurmountable in some scenarios. Okay, we're only halfway through the year. Is there still time to kind of get on track here?
Okay, so this is what I would recommend. I would say you need to anticipate, plan, and prepare.
Okay.
So anticipate that you might have a medical problem happen. Anticipate that if you have children, you're probably going to end up in the ER. Anticipate what that looks like and plan. Where do we go if we need stitches? Do we go to Instacare or do we go to the ER? What are the costs associated with each one? Because they're very different.
Yeah.
And then prepare. If you have an insurance policy with a $10,000 deductible, then you need to have $10,000 in savings. If you don't, then maybe get a lower deductible plan. Maybe get an HSA if you have a high deductible. So there's ways to plan and mitigate that, but do that now. There's time. People have, it's summer, you don't have the pressure of the holidays and all those other expenses. Get this taken care of.
Okay.
Get it paid off and focus on it.
All right, talk about reviewing spending, income, savings, and debt. Insurance can be confusing for a lot of
Insurance
people.
is confusing.
Yeah.
Insurance is confusing. So look at your policy. There's also a study done that says that 80% of medical bills are incorrect. And so look at the medical bills. My son had a surgery done on his nose. He had a deviated septum. He had a hard time breathing. And I got the fee schedule, and I thought that that's what the cost was. And then bills just start rolling in. I get a bill from the anesthesiologist. I thought that what I was paying included the facility. The facility is different. Right. So if you have a surgery scheduled, take a deep dive, make sure that you're including all of those other expenses. Ask your healthcare provider, what else am I going to have to pay for? What else is included? And make sure that you're looking into that.
I have found medical errors on my own medical bills. Another thing that I think a lot of people forget is negotiating medical bills. This is something I just learned recently. You can do this, right?
You can.
How do you do that? What's the first step?
You talk to your healthcare provider. So my husband's a healthcare provider, and if he has patients that have outstanding bills, and they call him and say, "Hey, I'm having a hard time paying this. Can I do a payment plan?" No questions asked, they will do a payment plan. He said it's so much better for them to just know that somebody's trying, even if it's $25, $100, than to say nothing and then to take all the resources in chasing down those receivables. So the hospitals will work with you on a payment plan. Your physicians will most likely. You just have to have that dialogue. You just have to start asking.
You mentioned HSAs and FSAs. Talk about those really quickly if you can.
Okay, so an HSA is a health savings account. FSA is a flexible spending account. Both can be used tax-free dollars. HSAs are better, though, because there's no expiration. You can use it indefinitely for surgeries, for contacts, for whatever, Band-Aids. It is probably the best tax vehicle that you can use. So if your business or your employer offers it, you need to utilize it.
Okay. If you do have an FSA, you have to use the money by a certain amount of time, right? So what would you advise to people when the time is getting short, basically?
Then I would probably buy your contacts,
Okay.
schedule your surgery, and it also is confined to that employer. So if you have the option, go with HSA, but the flexible spending accounts, still use them.
You also have an idea on here. You said automate small payments. What does that mean?
So if your hospital, if you owe the hospital money, if you owe your doctor money, put that on auto pay, just so that they know in good faith that you're paying every month, and kind of minimize any disruption there. I had an employee once who I got a garnishment for because she had an unpaid medical bill, and it was probably $1,500.
Yeah.
But for me, that was a bit of a red flag. You know, does this person meet their obligations? How well do they do planning? So I think that you got to make sure that you're taking care of things so that your wages don't get garnished, because they will.
For some reason, I've ended up on the side hustle area of TikTok. I see all these side hustles coming on. You're saying that's a good idea, especially if you redirect all of that money to maybe one area like medical debt, right?
So what are they redirecting on TikTok?
No,
you're just
I
saying
see so
you
many side
generate
hustle
money. I see.
Ideas.
I think that the more you can generate extra income, the more you can pay off your debts. You know, if you have a $10,000 deductible, you have to save for that. You have to plan. So I would absolutely say get a side hustle, go through your house and start selling stuff. If you have furniture you don't use, throw it on Facebook Marketplace. Get some of the debt paid off. $1,000, you can tackle that really fast.
And you said set a realistic goal too. If you have a mountain of things, I can understand how that feels overwhelming, but how do you break it down into little realistic goals?
I would say start with the little things. You know, your medical debts are probably going to be pretty low, so just get those paid off and done. And then plan. Say, okay, I need this much of my savings to cover my deductible. Make sure that you know the right facilities to go to, the right doctors to go to, that they're in network. And if you do have a procedure, talk to your physician and say, hey, what am I looking at here? If I pay out of pocket, is this any cheaper? Are there any other options? I remember once when we were in med school, my husband had a procedure done, and we asked if we could do it in office to save the anesthesia, and he did. So, yeah.
Sometimes the cash price is cheaper than the insurance price, or it'll surprise you at how cheap it is. So, Jenny, thank you for coming in. It's an important topic. I know it's a frustrating one for a lot of people.
Yeah.
All right, we're going to take a break. We will be right back. Stay with us.